Hello, I'm Arsha Vahabzadeh, reporting from CES 2016 from the Digital Health Summit studio, and I'm joined by Casper DeClercq, who is a general partner at Norwest Ventures. Welcome.
Thank you very much. It's nice to be here.
Thank you. You were just part of a panel. Can you tell me a little bit about it?
Sure. We talked a lot about the consumerization of healthcare and really this whole digital enterprise, what's happening with respect to the miniaturization and the mobilization in healthcare itself.
Do you have some more insights or summaries into whether things that particularly stood out in the panel for you?
Yeah, so we spoke a lot about what I would call the consumer wellness area, which is really around the Fitbits and the trackers that we all see, relatively inexpensive devices that are used by consumers in the sort of $50 to maybe $150 price range. We also spent a lot of time talking about, I think, the more important and the bigger spend in this whole market, which is the health dollars and the medical expenditures, and how consumer digital, both consumerization and expectations of consumers and patients are increasing, but also the electronics that with mobility, connectedness, miniaturization, that for the first time in history, healthcare can become three-dimensional phenomena as opposed to two-dimensional. When you walk into a physician's office, it's like a piece of paper in time. You come in, and with the several investments we've made, for example, you can see with a for example, like a Fitbit, you can also do that with diabetes or congestive heart failure or respiratory disease. What is happening with an individual over time?
That longitudinal information is very powerful, right?
So we've got a longitudinal perspective, which is extremely helpful for perspective for the physician, but also for patients who want to manage themselves more effectively and to take more responsibility for their healthcare.
When you think about this sector, over the next 12 months, 24 months, what does the future look like? What's exciting you and what do you think is going to happen?
Yeah, I think there's a massive shift from traditional healthcare payer environment to employers increasingly taking a role, being much more assertive with their employees, and increasingly, I think, disintermediating what traditional payers have done. So they're increasingly taking on health benefits and helping their employees as if they were consumers to make better choices and pay for those. So I think as the Cadillac tax comes in 2017, 2018, and also as people are moving to exchanges, that'll be a very interesting phenomenon, and I think a lot of that will be enabled by this digital health phenomenon. There's
an entire digital health revolution, it seems.
Yes, it's going to be happening. It might not happen immediately, but it's certainly going to be phenomenal in the next 5 to 10 years.
So people want to find out about the work that you're doing, about Norwest Ventures, where should they go?
You can look at our website. It's norwestventurepartners.nvp.com. And we're a very large fund. We've looked at thousands of digital health companies and are happy to help or consult with anybody.
I really appreciate your time. Thank you very much.
It's a pleasure meeting you.
This is Arsha Vahabzadeh reporting from the Digital Health Summit studio at CES 2016. Thank you.